All right. Well, we are on page 442 of the modalities guide, and we're going to focus on something that is sometimes a little tricky in the beginning to understand. And that's going to be the difference between constant voltage on CV, is what you're going to see this on the machines, and constant current as CC. A lot of this has really taken place in about the past 15 years or so. A lot of the machines are starting to add these options. These are traditionally for the plug-in machines. These are not typically available in a lot of the portable machines, and definitely not available in the Amazon 30, 40, $50 range type machines. But in the Chattanooga Intellect unit, you will see this option. It's especially important for certain waveforms. One of those is going to be Russian stimulation, or NMES. And as we talk about Russian and NMES, because of the change in position and because the patient may be sweating during this activity, in particular, there's a lot of value for using constant voltage as the parameter for NMES. So that would be something good to remember. But let's break this down a little bit more and get an idea for why it's important to know the difference between voltage and current. And this is going to get back to Ohm's law, which hopefully you remember what that is. I will pause the video here. Yes, so there we go. Voltage equals I times R, with I being current or intensity. And how do we typically measure current or intensity on electrical stimulation? How do we adjust that? Which unit? And how is resistance typically measured? And or do we adjust that for our patients? So yes, we know that with intensity, we can turn that up, and that's typically measured in milliamperage. The exception to that is if you're dealing with microcurrent, which we're not necessarily going over. Microcurrent will be measured in microamperage, and 1,000 microamps would be equivalent to 1 milliamp. But you can imagine if something is turned up to less than 1 milliamp, it's typically subsensory and the patient doesn't feel that. But that is something used in wound healing. And that's just an FYI. That's in your guide under microcurrent. And we know that typically, how high does the milliamperage go? Most machines will have a maximum milliamperage of 80. Some machines will go up to 100 milliamps. And then for the ACP units, some of them with certain waveforms, you have a max recommended level of 40. Although the machine will let you turn it up higher than 40 milliamps, they do sometimes recommend less than 40. But ultimately, if it's not, the electrodes aren't placed over the carotid sinus or over the heart if there's a pacemaker, or over a DVT or lumbopelvic area if pregnant, you can turn it up to 80 and be safe. However, it may result in significant pain because of the recruitment of sharp fibers. It may also result in muscle soreness and just really uncomfortable muscle contractions and delayed onset muscle soreness the following day. We also know that there's a range associated with cardiac arrest, which is 100 to 200 milliamps. So we want to stay away from that. What about resistance? You'll notice that resistance is measured in ohms. There's my best ohm symbol representation. And this typically is not something we can adjust on the machines. However, we can influence the ohms. We can do things to decrease the amount of ohms or resistance between the electrode and the patient. So you may be thinking about some of those things. Okay, here we go. So I've typed some things in here of ways that we can reduce the amount of ohms, reduce any kind of conductivity issue that we might have. Certainly cleaning the area. Often we use alcohol wipes to reduce any oils in the skin, lotions, anything else like that that may be more of an insulator as opposed to a conductor. But alcohol does cause dehydration, and it does decrease the moisture, the water, which is a good conductor because of all the other impurities and other things in the water, electrolytes and so forth. So when I say water, I'm talking about sweat that sometimes occurs on the skin. So cleaning the area with not just alcohol, but soap and water is good. What about shaving the hair? This is especially important. The most common place for this is probably if you're going to be doing Russian stimulation over the quadriceps. And a lot of guys that can be very hairy over the quadriceps, and shaving that hair, or actually even better than shaving, is clipping that hair. If you have a clipper and you go down to a number one, that's actually better because sometimes when you shave an area, it can be very sensitized. So if they are going to shave the area, we do recommend they shave the area maybe 12 to 24 hours prior so that we don't have a skin sensitivity issue. Certainly, this is something that gets ignored sometimes, is using old electrodes. And so sometimes clinicians are trying to save money, and so they may use an electrode 8, 9, 10, 11 times before they rotate in a new electrode. So using a high quality electrode and trying to limit that to generally less than 6 to 8 times is generally recommended. So sometimes just replacing the electrode is good. Another big part of how we can reduce the ohms is to experiment with the electrode placement. We know that bone is a relatively good insulator. So if you have part of the electrode over a bony landmark, this can be really common at the shoulder when you're trying to place it, especially if you're doing interferential around the shoulder. You have to really be careful to avoid certain bony prominences of the scapula or the AC joint or other superficial areas. At the ankle, this is also tricky because you have a lot of superficial bones and not necessarily a lot of good muscle connectivity at the ankle. So using electrodes placed differently, and also the other thing with that is cutting the electrodes if you need to avoid the bones. So sometimes when setting up a traditional 2x2 electrode, you have to really be careful with that on smaller patients if you want to put it on their ankle or their knee, because you're going to hit the fibular head or tibial area or other things like that. So sometimes cutting and trimming those electrodes a little bit can help you get a better conductivity with your existing electrode. So these are the ultimate things that go into the voltage over here. So on the majority of the machines, like I was mentioning before, we adjust this. So in terms of what do we adjust? We adjust the amperage on the machine, or I should say the milliamperage on the machine. And so we can turn that up and down, and generally to 80 is the max. But usually you know that we're working typically around 20, 30, 40 is common milliamperage range. And we turn that up. After 5 minutes, the patient accommodates, so we might turn that up further. What happens to the voltage as we increase the milliamperage? The voltage is always going to go up with a subsequent increase in the milliamperage, unless there's a reduction in the resistance. So let me give you a clinical example. Let's say you have a patient comes in and you're setting them up on Russian stimulation to the quadriceps. You have brand new electrodes on there. You put the electrodes on, and you secure those over the muscle bellies. And let's say you turn the intensity on the machine up to a 25 milliamps. Oh, there you go. So you turn the machine up to 25, and you're using new electrodes, and you have cleaned the area. So I'm just going to make up a number for resistance here, and let's just say it's 5. Let's make it easy. Let's make it 4 ohms of resistance under all the electrodes. So in this case, and don't worry about the units here, but let's just say you have 25 units here and you have 4 units here. For the equation, you're going to multiply 25 times 4, and you're going to get a voltage of 100. So that's on day 1. Now let's say a few weeks go by, the patient comes back, and you're really careful. You set the electrodes on this same exact spot. But this time, they they had some lotion. They were sweating, and then they took a shower. But then they put some lotion on their leg, and maybe the electrodes at this point are on their seventh time that you're using them. So you set the patient up, and instead of 4 ohms, you're getting more resistance because you have some insulators between the electrodes. The electrodes are lost conductivity; they're older, so every time you put an electrode on and take some off, some of that dead skin, maybe even some hair, pieces of hair, gets on the electrodes, and the electrodes aren't clean. So now you have a little bit of extra materials on the actual electrodes, which don't allow that. So instead of 4 ohms today, you're dealing with 8 ohms.